Shoulder replacement, preventing post-op complications. Introduction. Specialized tendons attach muscles to the head of the humerus bone in the shoulder joint. Select true or false. Correct. The combination of these tendons is known as the rotator cuff. Are heart attacks and other anesthesia-related complications common during and after this operation? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are dangerous, even though they are unlikely. The symptoms may include swelling, pain, or redness of the leg. Shortness of breath and chest pain may occur if a blood clot goes to the lungs. Rarely, a clot in the lungs can cause death without giving any other symptoms. Are infections common after surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections as well as bleeding and scarring may occur. It is impossible to injure the nerves and blood vessels going to the arm in this operation. Select true or false. Correct. It is very unlikely, but not impossible, to injure the nerves and blood vessels going to the arm in this surgery. Although these risks are rare, they can still happen. Shoulder replacement almost always reduces pain in the shoulder area. Select true or false. Correct. This operation successfully reduces pain in almost all cases, but there is a very small chance that your symptoms may get worse or come back with time. Mechanical failure of the prosthesis is common. Select true or false. Correct. Mechanical failure of the prosthesis is rare in this surgery. However, if it happens, another operation may be needed. Although these complications are rare, they can still happen. Thank you for using Explain.